Hello and welcome to a special interview for The Wire supported by Glenlivet Books. With concern and even fear about what Omicron can do to India growing with every single day, we ask, should the government not authorize boosters for selected parts of the population? And secondly, hasn't the time come for the government to decide about vaccination for children? Those are two key important issues I should raise today with one of India's top virologists, presently a senior research fellow at Green Templeton College in Oxford, from where he joins us, Shahid Jameel. Professor Jameel, although India today still has considerably less than 200 cases of Omicron, let's start with discussing what the data suggests could be the speed of spread if Omicron were to escalate. Data from South Africa, as well as from several European countries, shows that the doubling rate of Omicron is between 1.5 and 3 days, and that's almost double the doubling rate of Delta at a commensurate period of time. Data from the United Kingdom shows that the household transmission of Omicron is threefold greater than Delta. Taking the two together, does that suggest to you that if Omicron is going to spread in India, cases could rise exponentially?
Yes, Karan. Firstly, thank you for having me on your show. You're absolutely right. Numbers can expand exponentially. Even with limited data now available in India at this time, India, I believe, has till yesterday 147 cases, confirmed cases of Omicron. Even if you look at that data, and you go back in time, the past week, you will find that the doubling rate in India is also about 3 days. So in light of this, and the fact that Omicron is now established to cause more breakthrough infections, in fact, about 5 times more breakthrough infections than Delta. Breakthrough infections are infections that happen in people who already had a prior infection or people who are vaccinated. So with all this, if India is not careful, numbers can go up fairly quickly, considering the population density, especially in urban areas.
I'll come to severity of disease a little later, but first let's look at how well or how poorly protected are the Indian people against any spread of Omicron. Only 61% of the total population of the country has had one jab. Just about 40% of the total population of the country have had two. And that clearly means that 60% of the Indian population is inadequately vaccinated. Secondly, research done in South Africa suggests that, and this research was done against Pfizer, that Omicron can reduce 40-fold neutralizing antibodies. And I believe there's no reason to expect it will be any different with regards to AstraZeneca, which we call Covishield in India. So again, if you take the two together, doesn't it mean that whatever levels of vaccination we've achieved, they're not going to guard us effectively against infection from Omicron?
Yes, absolutely. The numbers you have cited are correct. India is currently vaccinating only adults, people who are 18 or above. And if you look at that number, and if you look at the number of doses that have been given in India, even among adults, you have 28% adults who have received only one dose, and 17% adults who have received no vaccines. Now, these people are just not going to be protected, neither from infection nor from disease, based on only vaccination. Coming back to the efficacy of any vaccine against boosters, firstly, you gave data about the Pfizer vaccine. The Pfizer vaccine, if it starts at that level of antibodies, the AstraZeneca vaccine starts at that level. And if both go down 40 times, then there will be much less antibody in people who got the AstraZeneca vaccine compared to people who got the Pfizer vaccine. T cells is another issue. AstraZeneca vaccine raises very good T cells, but we'll come to that when we talk about disease severity.
But you've made a very important point, because the level of antibodies that AstraZeneca, which is Covishield in India, raises is anyway less than the level Pfizer raises. And so if you have a 40-fold reduction in both, Pfizer will come down substantially, but AstraZeneca could come very close to being eliminated, which means any hope we have in India that 2 jabs of AstraZeneca will provide sufficient protection against infection from Omicron, that is a pretty bleak and slender hope.
Yes, and that is exactly what a new model that shows. A model has come out from Imperial College London on Thursday last week, which says that if you don't give any boosters, then the efficacy of the vaccine against Delta goes down to about 19%. The efficacy of the AstraZeneca vaccine goes down to about 3%. This is 6 months after the second dose.
This is again very important, Professor Jameel, and I'm repeating it so that the audience can once again hear it with emphasis. Studies done and released last Thursday by Imperial College show that against Omicron, the efficacy of Pfizer goes down to 19%, and the efficacy of AstraZeneca, which we call Covishield, goes down to 3%. 3% is virtually negligible.
It's negligible. It will not protect against symptomatic infection, and that's why you have so many breakthrough infections. However, if you gave a booster, then 2 months after taking the booster, your efficacy is up to 81% against Delta and 39% against Omicron. So it's still much less for Omicron, but at least there is some efficacy to protect.
Now, the second belief why people say India could be in a better position versus Omicron than the rest of the world is because we have a very high level of national seropositivity. It's been shown to be just short of 68%. But studies done in South Africa by Juliet Pulliam show that, in fact, Omicron is 3 times more likely to create reinfections than Delta or Beta. And as a result of this, in an article you wrote for the Indian Express just 2 days ago, you said, and I'm quoting you, prior infection with other variants has minimal capacity to neutralize Omicron. So once again, any hope that our high level of seropositivity can protect us against infection from Omicron is once again a bleak, slender hope.
Yes. All the emerging data and the imperial model that I talked about show very clearly that prior infection is not going to do very much to protect from reinfection by Omicron. Again, disease is another matter which we shall discuss.
So just to sum up this, because it's so important, neither the levels of vaccination achieved in India nor the earlier seropositivity achieved in India are anywhere sufficient enough to protect us against infection from Omicron. That is correct, isn't it?
Yes, it is correct, against infection and mild disease.
Now, in fact, if a large number of people do end up getting infected, even though the disease, we hope and pray, is mild, a small fraction of that large number will inevitably end up in hospital. And a small fraction of a large number is itself, in absolute terms, a fairly large number. They will need hospital beds, they will need oxygen, they will need ventilators, they will need medicine. And so they will put pressure on India's already pretty shaky health system. Is that also correct?
That is correct. In fact, that is the article in Indian Express that you quote from. I said there as well that a small fraction of a very large number is still a large number. And therefore, we must be ready for it. We should prepare hospital capacity and everything else that goes around it. That needs to be in place.
Absolutely. But before we come to preparing hospital capacity, which is something the government must do, the next and first question that's raised is, doesn't this create a case for boosters? Let's just pause and consider the picture we've painted. If Omicron does spread in India, it could spread exponentially. Our vaccination levels and our seropositivity level will not be sufficient protection. That could lead to a large number of people getting infected. And even if a small fraction of them end up in hospital, it will still be a large number of people in hospital, creating tremendous stress for India's already very fragile health system. Before I come to boosters, let me ask you one quick question. Is there any credible chance that Omicron will work differently in India than it did in the rest of the world? Everything we're saying is on the basis of Omicron behaving in India as it has elsewhere. But is there a chance Omicron will behave differently, i.e., India could be unique and exceptional?
Well, the last 12 months have shown us that India is not unique and special. Indians suffer from infection and disease just like everyone else anywhere in the world. We may not see it because we may not be testing enough. We may not see it because the reporting structure is not as efficient. But cumulative evidence over the past year has shown that Indians are not special. Let's get out of this mode, understand the problem, because only then we'll be able to address it.
In which case, if Indians are not special, if India is not unique, if India is not exceptional, let's come to that key question. Given what we've now discussed very thoroughly, shouldn't the government immediately authorize boosters for select sections of the population without waiting for everyone to be first fully vaccinated?
Yes, so there are multiple issues here. Based on the available evidence at this point, protection from infection is minimal, almost non-existent. Also, let me point out that modeling shows that protection from severe disease without a booster goes down to only about 25 to 30%. And protection against mortality, protection against severe disease goes down to about 20%. Protection against death, against mortality, goes down to about 30%. So, this notion that we will continue to be protected against severe disease and mortality based on the most current understanding is also not correct. Now, let us get to boosters. Yes, in light of all this data, I think boosters are required. Also for a reason, I mean, if we say that, fine, a lot of people will get infected as long as they don't show severe disease. The problem with that argument, Karan, is that we don't understand what long COVID is. We don't understand what happens to people who even get a mild infection a few years down the road. And there are at least anecdotal evidence that people who even suffer a mild or asymptomatic infection can have fairly serious long COVID effects depending upon their health condition.
You're making two very important points, and I'm underlining them from the audience. The first is you've repeated what we discussed earlier, that because protection against infection will be so poor without boosters, a lot of people will get infected and a fair number could end up in hospital. And if you don't give them boosters, you're going to put a huge lot of pressure on the health system. But you're also saying that even protection against severe disease and death falls very sharply without boosters. If I heard you correctly, against severe disease without a booster, protection is down to 20%. Against mortality, without a booster, it's down to 30%. Those are all credible reasons for the government immediately authorizing boosters. Wouldn't you say so?
I would think so, yes. I think the least we should do is to have a very clear policy on boosters. I think the government needs to decide and come out and say, what is the strategy?
Well, forgive me. The government has actually made that strategy clear. We're now disputing the accuracy and validity of the strategy. The government strategy, repeated many times at press conferences, is that boosters are not necessary at the moment. We must first fully vaccinate everyone. You're now saying to me, waiting to first fully vaccinate everyone before you give boosters to select sections of the population is wrong. Those select sections must get boosters now immediately. So we're disputing the government's so-called strategy.
Well, Karan, I had the same view till I read in detail what Imperial College has just put out. And I think people who sit on the government committee need to very carefully read up that model. It very clearly lays out the situation for countries like India, which have had large numbers of infected people in a previous wave, but where the vaccination rates are still low. And we've seen what percent of Indians remain
absolutely. In fact, let me quote from that study because it will help the audience. I'm quoting from that Imperial College study. It says, targeting boosters to the highest risk groups to ensure continued high protection in the face of waning immunity is of greater benefit than giving those doses as primary vaccination to younger age groups. So very clearly, Imperial College is saying, yes, the priority should be boosters for the aged or those with comorbidities whose immunity is waning. Much lower down in priority comes giving primary vaccination to younger age groups.
Yes, I was coming to that.
Does not accept, but you're saying to the government, they should now change their strategy and accept the advice from Imperial College.
Look, I was coming to that. The model also goes on to quantify this and says that if you did this, you would prevent up to 5% mortality if you gave boosters now to people who are at risk, meaning the elderly and people with severe comorbidities, compared to if you didn't do that and continued to give vaccines to younger people to prevent transmission. We're not going to stop transmission of this virus. It's pretty clear now.
You're saying something again very important. You're saying giving boosters now to the elderly and the immunocompromised will prevent 5% of mortality. Not giving them boosters means that you are allowing 5% to die who otherwise could have been saved. 5% of yes, potential lives are at stake if you don't give boosters. That's what you said, sir.
That's what the model says. That's what the model says. And if you read it, it's a very detailed model where they have gone into, but let me qualify that and say that all the model assumptions are based on neutralizing antibody levels. They are not based on measuring T cell levels.
Quite right.
Okay.
As yet, no great major studies have been done about T cell levels after an infection by Omicron. So we can only talk about antibodies. But at the moment, yes, the decision has to be made on the basis of what's available. And the data based on antibodies is saying quite clearly that you will end up incurring 5% unnecessary deaths if you don't give boosters. In other words, yes, 5% of people who don't need to die will otherwise die. Let me put this to you. It's so clear. I don't think we need to go on about the need for boosters. I take it this is also your advice that boosters must be given to those who need it immediately. You can't afford to wait.
Yes, as per these new studies, you must do that. And for that, you need to make a policy and understand what it requires to give boosters.
Absolutely. But let's not get into the details of policy, because how the government makes its policy and what it is, we do know as of now. They need to change it. We know that too. But when they change it is up to them. We're simply airing the issue for the audience, and hopefully the government will hear you. And it's crystal clear. You need to give boosters immediately to those who need them. And if you don't, 5% of people who don't need to die will die. I keep repeating it because it's a very large number, given the potential size of the Indian population. 2, 3 quick questions. Are boosters needed? only for the immunocompromised or for healthcare workers and frontline workers as well, or also for everyone over 60?
Well, this modeling study talks about the people who are at high risk for severe disease and mortality. And those are the elderly and people who have weak immune systems. Healthcare workers, if it's a 25-year-old healthcare worker, that's not covered in this model.
Okay, so you're very clear. Boosters are needed immediately for the immunocompromised and for the elderly. I assume elderly is taken to be people over 60. Let's then come to the second question. If a booster or a third jab is essential and immediately necessary, which is the right vaccine? In your Indian Express article, you said Covishield would not work well as a booster dose in people who have already received 2 doses of it. But a study done by the University of Southampton and also reported by Lancet says that AstraZeneca, which we call Covishield in India, does work pretty well as a third jab. So do you still rule out Covishield, or are you prepared to say that if the University of Southampton says it works well, use it? Because, and I'll tell you why I ask, 90% of the vaccines in India are Covishield. So ruling out Covishield as a third jab could be a problem.
I will stick to my earlier argument. And in fact, the Southampton study that you quote, if you look into the details, and the devil is always in the details, if you look at the details, then a third shot of AstraZeneca vaccine gives far less boosting effect than the other vaccines that are available.
Okay.
So, in fact, if you carefully look at all the tables, all the results from that study, and it's a large study, to put it into context, what this study did was to take people who were earlier given 2 jabs of the AstraZeneca vaccine or 2 jabs of the Pfizer vaccine. And then they were divided into groups, and each group got 1 of 7 other vaccines as a booster. So it's a pretty large study. Now, the outcome of that study is that the best boosting effect you get is if you give 2 jabs of RNA vaccine followed by another RNA vaccine. So Pfizer, after that, either Pfizer or Moderna. The next best is you get 2 jabs of AstraZeneca, and then you get either Pfizer or Moderna. The next best is first Pfizer and then AstraZeneca. Then comes RNA followed by protein boosting, and finally AstraZeneca followed by protein boosting. AstraZeneca followed by AstraZeneca comes much later. In fact, even half a dose of a protein vaccine is better at boosting than a full dose of AstraZeneca vaccine.
All right, that's perfectly clear. Of all the vaccines which were tested by the University of Southampton, it seems AstraZeneca as a third jab produced the weakest outcome. It may still be considered good, but it's the weakest of the 7 outcomes that study went into. In which case...
No, but the point is, but let me clarify this, Karan. The point is, if you are going to invest a dose in boosting, you want to use the best possible boost that you can get.
In which case,
why
let me ask
would
you
you
this question.
suboptimally boost anyone?
Let me ask you this question. If you want the best dose the boost can give, then of the vaccines available in India, I'll come to foreign vaccines later, of the vaccines available in India, which would you suggest? There's Covaxin, which is available, and there's Covovax, which the WHO has cleared, but surprisingly, the Indian drug regulator still hasn't cleared it, but presumably he will at some point. Of these 2, which would be better?
I would use Covovax, which is the protein vaccine. Again, going back to the Southampton study, although they did not test Covaxin, they did test another killed virus vaccine, which is similar to Covaxin. And that produced very little boosting effect. So I don't think Covaxin, based on this data, is going to show much boosting. On the other hand, protein vaccines, the Novavax vaccine, even at a half dose, gives reasonably good boosting. So I would really urge the Indian regulator, now that WHO has also given its approval to Covovax, to go ahead and approve it with urgency.
So what we're saying, Professor Jameel, is that if the booster is to be only from vaccines that are presently available in India, if it's only from vaccines presently available, then Covovax is infinitely preferable to Covaxin as the booster because it is a protein vaccine. And your study in Southampton has clearly shown that even half a dose of a protein provides great boosting results. Now, this raises another question. Clearly, we don't have enough supply of either Covaxin or Covovax. If boosters are to be given to everyone over the age of 60, right, that is alone 138 million people. Beyond that, there are also people who are immunocompromised. I don't have a figure for them, but we're ruling out healthcare workers and frontline workers because they tend to be young. Now, if you're talking of something like 150 million jabs needed, Covaxin claims to make only 50 million a month. And that, by the way, is a claim many people dispute. People think it's lower. And we have no idea how much of COVAX is made a month by the Serum Institute. So clearly, we don't have enough of these two. Doesn't that mean we need to import from abroad to make up the numbers?
Well, in June, Serum Institute came out with an announcement saying that by December this year, they will have 200 million doses of Covovax available. Now, I have not found any recent announcements from Serum as to how many doses they have made and stockpiled. But this is something to look into. Maybe they have enough doses. And in any case, you're not going to use 150 million doses all at once. So if the approval came, let's say today, and they have, let's say, 50 million doses already stockpiled, we can get started with that.
Yes, but we don't know how much of that has also been earmarked as exports because exports have been allowed. We know that some sizable amount of Covovax has already been given to Indonesia. The bottom line is, at the moment, we don't have an answer to that question. Do we have enough in terms of quantity of Covovax or Covaxin to give us boosters?
We don't, and we won't have an answer. We won't have an answer unless we make a policy and decide what we are going to do.
Yes, and absolutely. And that requires the government to wake up and make up its mind. But at the moment, the government seems to be convinced that ensuring full vaccination for everyone is more important than giving boosters. You've just categorically shown that the Imperial College studies suggest that is not the right priority. But obviously, that is a debate to be had with the government, and hopefully the government will hear you and take your advice. But there's another question that comes. If, as you said yourself, the best booster to give is the one that is most effective in raising immunity, and that clearly from what you said about the Southampton study is an mRNA vaccine. And that draws my attention to the fact that in Britain, only mRNA vaccines have been given as boosters, and primarily it was Pfizer, not even Moderna. And practically everyone in Britain who had 2 jabs of AstraZeneca got Pfizer. And even the studies show, which you've quoted, that that is the best combination. So shouldn't India, if the best is to be given, find a way of hastily importing either Moderna or Pfizer?
Well, in an ideal world, yes. But if India wanted to start importing RNA vaccines today, everyone needs those vaccines everywhere in the world. It won't be available to us tomorrow.
Absolutely. We've left it too late. We should have woken up to this need earlier. By the way, the realization that an mRNA vaccine as a booster after 2 jabs of AstraZeneca is not something that happened just a couple of days ago. The Southampton study has confirmed it, but the British were following it a lot earlier as well. They began boosters 2-3 months ago, not just 2 days ago. They began it actually before Omicron hit them. Omicron only expedited it. Let me come now to 2-3 other questions, which are important, but I'll ask you for shorter answers. With Omicron staring us in the face, is there a need to reduce the gap between 2 doses of Covishield? At the moment, it's anything up to 16 weeks. Should we reduce it to 8, which is what Britain did several months ago, because that would ensure a bigger number of people get fully vaccinated much more quickly?
No, absolutely. And this is something, again, which I have written very clearly, saying that one way of covering more people is to reduce the gap between 2 doses of Covishield. Currently, it's 12 to 16 weeks, but practically you can't get an appointment for a second dose unless you have completed 84 days or 16 weeks. Bring it down to 8 to 12 weeks so that at least after 12 weeks, people can get the second dose. It's absolutely essential. We're talking about boosters here, but boosters can only be given to people who have received 2 doses. You can't give a booster to somebody who has received no vaccine or just 1 dose.
Absolutely. And that brings me to the second question. There are a large number of people who are vulnerable because of their age, who have not had a second jab. Professor Rijo John tells me that 36% of people over 60 haven't got a second jab. 34% of people over 45 haven't got a second jab. Shouldn't their second jabs be expedited also?
Well, I don't know about those numbers. I think Rijo must have calculated them carefully, but when I compute it based on doses, it comes to be a little different. But let's not get into those details. It is important that people who are vulnerable and who have received only 1 dose, they must get a second dose very, very quickly.
My last issue.
Immediately after 8 weeks.
My last issue. What about vaccination for children? With Omicron staring us in the face, is that a decision the government needs to urgently take?
Well, yes. And we need to have a policy for that, because I keep saying that, if you make a policy today, you're not going to start having everything, tomorrow. Make a policy, decide very clearly how you are going to vaccinate, what vaccine you'll use, how many doses will be needed, all of that. Look at the reality for children. In India, only 2 vaccines have been tested on children, Covaxin and Zycov-D. And both, as far as I know, have not yet been approved for vaccinating children. I may be wrong.
Let me correct you on that. Covaxin has got a clearance from the subject expert committee, but not from the drug regulator. Right. So Covaxin is definitely not cleared. Yes. Zycov-D has been cleared both by the subject expert committee and by the drug regulator, but the government has still not decided about giving Zycov-D to children.
Yes, Zycov-D was actually approved in August, and it is a matter of concern that it still hasn't been rolled out into the vaccination program.
And another matter of concern is Zycov-D being made in sufficient numbers to give to Indian children? Because remember, that section of the population is probably the biggest, and therefore you need the most number of vaccines for them. Yeah. And we simply have no idea how much Zycov-D produces a month.
It's a 3-dose vaccine. So maybe they are conducting studies with 2 doses before they roll it out, because 3 doses is logistically going to be more complicated than already we have with 2 doses. Well, so I don't really know what the issues are, but certainly getting back to your question, again, I think children will eventually need a vaccine. And the earlier we make a policy, the earlier we decide how we are going to go about it, the better it is.
Let me take up that point that you made about the government having to make a policy, because you brought it up several times in this interview. The minister has repeatedly said that the decision whether boosters are to be given, and separately and secondly, the decision whether children are to be vaccinated will be taken on the basis of science, on the basis of what expert committees advise. Now,
well,
just
all
to
we are discussing is science
restrict ourselves to boosters, the science is now clearly showing that there is greater need to give boosters to the elderly and build up their waning immunity than to continue to fully vaccinate younger people. The science has spoken. It's not that the science hasn't spoken. It's just
So
that the so-called committees in India either aren't listening to the science or they're looking for different science to listen to because the science is proven.
All we have done today, Karan, is to discuss the available evidence, the available data, and the science. This is a very fast-moving situation. Science is also changing by the week. And therefore, it is important that the people who sit on these committees keep themselves updated with the science and take decisions that are based on the most recently available data. That's very, very important.
Absolutely. And the implication of that, I'm just spelling it out, is that perhaps people sitting on critical committees in India are not keeping themselves up to date with the science and are not aware, for instance, of the Imperial College study that you cited at such length, or the University of Southampton study, which points out which vaccine would make the best booster. Those are studies that should be understood. They've been covered, by the way, by Indian papers. The Hindustan Times in particular has covered them. A young reporter called Binayak Dasgupta has done excellent work reporting them. Why on earth our scientists aren't reading them and keeping them in mind, I don't know. But I'm going to end by thanking you for one thing in particular, Professor Jameel. You pointed out that if boosters are not immediately given to people in need, i.e. the elderly and the immunocompromised, the Imperial College studies suggest that 5% more people could end up dying than otherwise would be the case. And remember, in India, where the population is 1.38 billion, 5% unnecessary deaths is a lot of people. I'm not going to try and put a figure to it. I don't want to attract controversy by quoting numbers. But 5% deaths, which you can avoid if you give boosters, it seems almost irresponsible not to avoid them and continue not to give boosters. I thank you for that stark message, Professor Jameel. I hope the government is listening. Meanwhile, take care, stay safe, and keep away from Greek alphabets.
Thank you, Karan.